Okay, good morning and welcome to the June 23rd, 2021 COVID-focused meeting of the Needham Board of Health. I'm Rob Partridge, Chair of the Needham Board of Health. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12, 2020, due to the COVID-19 pandemic emergency and is being recorded. Public access to this meeting does not ensure there will be public participation unless required by law. Public comment at this meeting is not anticipated. I'll introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown?
Yes.
Steve Epstein?
Yes.
And Ed is going to be late and Christina will not be able to make it. And we also have Tiffany Syke?
Yes.
Talib?
Yes.
Mary Fountain?
Yes.
And Tara Gurge?
Yes.
Okay, I think that's everybody. So we'll come to the first item on our agenda, which is the COVID-19 update.
Sure. So I'll share screen. So Tiffany and I are going to tag team this with a little help from Mary, I think. We wanted for the board's last COVID meeting to sort of give a wrap up of the COVID-19 pandemic from Needham's perspective. This isn't to say that the COVID-19 pandemic is completely finished. There's still sort of work to do with some contact tracing. There's still more vaccination work to do, especially as different age groups become eligible for vaccine. And there's still certainly finishing some vaccinations for people who've only had one dose. But in terms of the sort of emergency nature of the work the Needham Public Health Division is doing, I think, that has wound down. And now we're in, for lack of a better word, mostly the recovery phase. We're trying to document, we're trying to start an after action process. We're trying to look at strengths and weaknesses, and we're trying to give the board a sort of a general summary and overview of what occurred. Obviously, these slides were put together by Hannah Whitehead. We've been very fortunate to have her services and we'll continue to have her services for a few more months. I think from my perspective, it's very valuable to have this, to have someone who is collecting, analyzing, and visually displaying data. And I think that that's one of my priorities going forward, is to try to have that function available as much as possible. It's not a function that historically has been in the operating budget. It's something we applied for a grant at the start of the COVID-19 pandemic to try to do, and I think it's been very valuable. You can see a nice sort of colorful chart here with the overall age breakdown of cases. You can see a comparison between our sort of first month of business, March 2020, our busiest month, which was January, and April, which we're even lower than that in May, and we'll be lower than that in June. So nice sort of bookends. Cumulative cases under 1,800 so far. 7-day rolling average, you can see we hit a little bit of a high in the spring, and that was a large number of cases in long-term care facilities and assisted living locations. And then, as the pandemic went on, cases sort of spread across the age spectrum. There were few, if any, cases in young people at this point. And then as the pandemic went on and as schools and there was interaction, a higher number of cases were from school-age children, college age, and young professional age. Our peak was in the middle of January, and we've been sort of downward trending generally ever since, which is a great thing. Tiffany and Mary, would you take this slide?
Sure. So this slide just kind of goes through what it looked like throughout our year with public health nursing team. Started with Donna and I, and a few of the nurses from the schools who volunteered to help us, which was awesome. And then Donna retired, and as the cases went down in the middle of the summer last year, it was just kind of me, and we had our one intern a little bit, but then she left in August. So that our true contact tracing team really got put together when Mary thankfully arrived to us in October, and kind of have worked from there. We've continued a close relationship with the CTC. Literally, we text back and forth probably daily with them. Use them a bit in the summertime, try to relax it when Hannah and Mary were with us and not use it as much, so we knew what was happening. But as caseloads increased, we had to develop that relationship with them to maintain the ability to keep track of the cases and contact them. So we've done that as we've gone on. They really took the lead with anything that happened with Olin College, which actually wasn't that many, thankfully. So that was nice. And then a lot of the state took on a lot of the cases at the long-term care facilities. So we would get contacts with them, but they would really do the keeping of the information. As the schools went on, actually, maybe I'll let Mary talk about the schools and the nurses and how you've handled all that over the last bit.
Sure. CTC was also used for any non-Needham schools. So anything, or non-Needham residents in the Needham schools. So if they lived in Boston and they came in here for whatever reason, then those generally, we would do those in conjunction with the CTC because we wouldn't have access to that case. The rest of the Needham public schools was an evolving process. And I think right when we finally got everything smoothed out and figured out a really good system, the cases dropped off because we reached kind of that critical threshold of vaccination in the town. But that involved daily contact with their director of health, Barbara Singer, who is retiring next week. And then individual contact with the individual school nurses. So I worked primarily to make sure all of that, any questions they had about when people could come back to school and whatnot, went through me directly. And then in January, when we were able to bring on, or we got into the process of bringing on the rest of my team, because January was hectic. We brought on those 3 members, and then they were able to pretty quickly integrate and help with school tracing on the weekends, and just kind of had that presence who could connect with people who maybe weren't answering the phone over the weekday, or if anything came in over the weekend, they could handle it, and then Tiffany and I could finally have weekends off again. With a brief update on my contact tracing team. So they are all leaving at the end of June, also next week. And they're all on to bigger and brighter things. Jessica Fuchs has accepted an epidemiology fellowship with the Department of Health in Santa Fe, New Mexico. And she'll be there for the next 2 years, working with maternal and child health. Amy McInerney just accepted a position as the public health coordinator for the town of Leicester, their regional public health coalition, which is part of one of those DPH grants to form coalitions. And then Isabella Caruso will be continuing her education at UMass Amherst as she got accepted into the epidemiology doctoral program. So she'll be starting her PhD program this fall, and she wants to focus research on women's health, specifically chronic diseases. So the 3 of them have all been phenomenal, and we're kind of excited to see where they go in the future.
Yes, we owe a lot to them over the last 6 months. So, and just to touch on to date, the last kind of paragraph and bullet points on here, the 1621 is the one numbers we've investigated because we have had the CTC help us with the 311. The contacts are a total approximate because at points in time, like when I was working by myself, I did not get contacts entered in Maven, things like that. So at times when it gets too busy, it just did not get put in. It was done more on paper, so there was no real tracking of that. The guesstimate of the amount of contacts, I do think we had about 4 to 5 as people really got a little bit more educated about it and what it was. it definitely declined to about 2 to 3 per case. Unless we're talking a sports related case, then of course there was a lot more.
With the caveat also that a lot of times the contacts were household contacts that would then become cases, and then we wouldn't count them as contacts anymore. So if everybody in the household turns positive and the only contacts were in the household, then a person's average contacts would drop to 0.
Yeah, true. Thank you. And then the clusters, 63 total clusters over the last year. And one thing to note on that is a daycare cluster is considered 1 case. So it's really not a true cluster. It's just 1 case. So, but that's how the state has always worked with that. All the other clusters are 2 or more, except for, I think, did they also create them for sports with just 1 case? No. Okay. Yeah. All right.
So this slide charts COVID deaths. This was a process we worked with the town clerk's office. The health department doesn't get death reporting numbers. So this is something that we coordinated with the town clerk and with data released by the state. There were 125 COVID-19 deaths recorded in Needham thus far. We only have data available for 114 of the cases. So we're not sure if some of that's a data lag or something that was missed either by the funeral home or the hospital or the town clerk's office. I think they're all working to figure out what that was, but we have the vast majority of the information on those cases. The youngest case was in that person's 40s. Oldest case was over 100 years old. As you can see, the median age was quite far into the sort of older age bracket, which was the most at high risk for COVID-19 complications. Needham, as you know, has a number of assisted living and long-term care facilities, more than sort of would be typical in a community of our size. So it's not entirely surprising that there were, unfortunately, a number of deaths in Needham. There were also some facilities in Needham that were willing to take COVID-19 patients who had been at the hospital, had specific medical orders that did not sort of allow for extraordinary means, and Needham had a facility or 2 that was willing to take those patients for their last remaining time. So that also increased Needham's death numbers. As you can see, the supermajority of the fatalities were related to assisted living and long-term care facilities. Tiff, can you take over for vaccination clinics?
Sure. So with our vaccination clinics, our first one was January 11th when we started with the first responders clinics, and then have kind of continued. We had one on June 9th, and then we've done second doses just kind of throughout the last week and this week. So we've done a total of about 37 clinic days. 6,944 vaccinations were administered with 25 homebound vaccinations. 3,500 people vaccinated and 98% of them were fully vaccinated. We did residents from 200 towns and cities, and then 12 from out of Massachusetts. And just as approximate, with all the volunteers, the MRC volunteers and the per diem nurses we've used, if you were to do the total amount of hours spent at the clinic, it was over 600 volunteer hours used and greater than 4,500 hours, or over 600 volunteers used and greater than 4,500 hours served. So we are very thankful for our MRC, for Talib for helping us with that, and for all of the volunteer. They have also been great. We had a contact from Dedham last week asking for volunteers. They didn't have enough nurses to help do their, I think it was a high school vaccination clinic, their second doses. So we put out a thing and like 10 of them volunteered. So we have a really great group of MRC volunteers, and we're very lucky to have them with us. So
I think one of the things that we learned through this pandemic, obviously, is that when there is a major emergency, people are very interested in helping. I think one of our challenges going forward is continuing to engage those people, to give them sort of opportunities for training and development, and potentially opportunities to deploy in some limited circumstances so that they stay engaged. We had a fairly quick ramp up, in large part thanks to Talib and the work he did supporting Tiffany. But when we sort of started the pandemic, our medical reserve corps was not, we had a small number of very committed people, but not a very large number of committed people. So I think one of our challenges going forward is how to continue to have a larger group of engaged people, and how to sort of continually keep them bought in. It's certainly something we're going to be working on, and we're glad that Talib is going to be helping us with that work. This is vaccination data that is not specifically Needham public health delivered vaccines. This is vaccination of Needham residents. It's drawn exclusively from state data. As you can see, and this is updated as of late last week, 84% of residents of the town have had at least one dose of COVID-19 vaccine. 73% are fully vaccinated. You can see across in sort of the right-hand chart, the percentage or the relative share in green compared to blue teal, the group that are fully vaccinated and the group that is partially vaccinated. Obviously, in the 12 to 15-year-old age bracket, which is the group that has been eligible for vaccination for the least period of time, there is a larger portion of partially vaccinated individuals. That's largely a function of the fact that there hasn't been really much time for them to get fully vaccinated, which obviously takes an initial shot, a second shot 2 weeks later, and then a 2-week period for full vaccination status. So we expect if we pull this data in a week and then a week after that, that the proportion of green to blue will shift much more heavily towards green. We're very happy with those numbers. As you see from the first bullet, about 16% of the town is under 12 years old, so is not eligible for any form of vaccination. So the fact that 84% have had at least one dose suggests that the number of people who were unwilling to accept vaccination of any kind is very, very small in Needham. That speaks well to sort of the herd immunity of the community. It also speaks well to the relative safety of any sort of gatherings of any kind in Needham. So I think that's a very positive piece of information. The last slide looks at COVID in the Needham public schools, and I'll again ask Tiffany and Mary to talk a little bit about this one.
Sure. So during the year, COVID prevention policies and measures were in place, hybrid, in-person, remote learning model. All those things that they have done, HVAC assessments and improvements to indoor air quality. We were very fortunate in Needham Public Schools to not have too many in-school transmissions. And so there were only 3 instances that we could assume that they were in-school transmission, and then 1 in-school cluster. Again, the school nurses led contact tracing for infected students around the early beginning of this year, and would contact Mary, and we would contact the contacts and let them know that they needed to be quarantined and go that route. So the school nurses really did a lot for us this past year. Those 12 years and older are eligible for the Pfizer. We have a good rate, as Tim just spoke about, 93% in Needham, which is awesome. And they were run by PelMed Pharmacy. So we're grateful that they could step in and do that. So overall, 392 cases, 5 to 18 years, which is about 22% of Needham's confirmed cases.
So I will stop the screen share and ask the board if they have any questions or if there's anything they'd like to go over.
I will say that those slides are an amazing summary of how a worldwide pandemic affects and the response to in a small town. It's quite remarkable, and I want to thank everybody for all the work that they've done to get all of these achievements done in such a timely fashion. I wish it was faster, of course we all would, but it's amazing where we are now compared to where we were a year ago. One question I had was about contact tracing. It seems like we're going to lose a lot of contact tracers. We've obviously learned a lot about how to gather that information. Do you feel that you'd be able to ramp up pretty quickly if we started to have another bump in cases?
I actually do, if you don't mind me fielding this one. As much as I'd never want to relive January, I know I can personally handle 30 cases in a day. I don't want to do that again, but I'm capable of it in the short term. But we've established a lot of phenomenal relationships. We've got per diem nurses. We could get MRC volunteers back or our per diem nursing staff pretty quickly. And then they're not looking to get rid of the CTC entirely until September. I know Tim and Tiffany have other sort of irons in the fire in terms of long-term stability, but I think if there was something that came up in the short term, it's definitely something we can handle, and we've got enough extra help who've come in over the course of the year who could step in if things really got overwhelming pretty quickly. With the side note also, if we have a huge jump in caseload, there's probably something else going on, and other aspects of public health nursing are probably going to be shutting down a bit. We will probably have a little bit more time away from our other obligations if we end up with another spike that requires a lot of contact tracing. There'll be other societal things happening, I think, that would force us to divert our energy.
Yeah, and to speak to what Mary was talking about, the state has formed grants available to shared services collaboratives. And so we are speaking with Dover and Medfield to combine a shared service collaborative and ask for around $110,000 to do not only a full-time another public health / epi, but also a part-time epi who can continue to help all the towns with data and information around COVID-19. And that starts strictly with COVID-19 contact tracing, but as things change, they have also said, you know, they can of course continue to do other public health related work as well. So.
Yeah, I think that's pretty exciting. In addition to the shared contact tracing and epi services that Tiffany was mentioning, there is another grant that I think we hope to put our hat and name in the hat for, which is a shared services grant, again, possibly with Dover and Medfield if they agree. We're a fairly small set of communities, and none of our communities contain sort of environmental justice areas. So we would be a bit of a long shot. But I think there's potentially some value there. Dover and Medfield, are communities that don't have health departments of similar size. They're often relying on contractors or board members to fulfill some of the sort of statutory obligations. So there would potentially be value in sharing some services, sharing training, standardizing some types of inspections and trainings. Specifically, I think a lot of the work that Tara and Diana have done on the FDA food code standards is something we'd love to sort of share our expertise on, and we think there's real value there.
Great.
Are there any modifications to contact tracing, like given better resources, like we talk about the forward versus backward contact tracing, like where did the case become a case? So how do, investigating more detail on that and deploying rapid tests. Is that something that we might think about or program to include that?
So one of the problems that we're experiencing right now with the rapid testing, especially like rapid antigen tests, is with prevalence so low in the community, the false positive rates on rapid testing is exceptionally high. And so the only positives we've had in town recently were 2 false positive antigen tests. So in terms of, rapid testing, I don't think that's, at this point, it's probably not in our best interest. It causes a little bit more trouble than it would solve.
Asymptomatic screening of a population, but when people have been exposed, it can be a tool where you measure each day to see if infection develops. So it's just something to think about in terms of a response to a case, I think. And it's available and pretty cheap, if not free, from the state. So it's something to think about. I think in the schools, we're talking about having that available rather than have kids sit in quarantine. Could you test to stay kind of thing? Anyway, something to think about.
Great. Are there other questions from the board? Given that this was a COVID-focused meeting, there wasn't a ton on the agenda besides that. The other item that I did have on the agenda was just sort of an announcement, and Mary provided part of it, which is that we're going to unfortunately lose our talented contact tracing team, or parts of our contact tracing team. We do also have a number of staff who haven't taken much vacation in the last 16 or 17 months. So we are going to balance over the summer, letting people take vacations, even slightly longer vacations maybe than usual, while still maintaining full coverage. The town has gone to its summer schedule, which is 8 to 5 Monday, Wednesday, Thursday, 8 to 6:30 on Wednesdays, and then 8 to noon on Fridays. We have staff that work sort of outside those hours. I usually work Friday afternoons. Marianne often works Friday afternoons. Mary actually works 11 to 7. So we don't just have sort of coverage 8:30 to 5 like we would in sort of the winter. But that is something sort of to know that, especially when if we need to work with other town departments, I think there was a request a week or two ago for us to work with another town department and get an opinion from town council, and it came in on a Friday afternoon. And unfortunately, most everyone else in town is gone by that point, except the people who are running the pool. So it's just something for folks to keep in mind. Yeah, I know we had planned for an hour, but I think that's most of the material we wanted to present. What other questions do the board members have?
This isn't really a question as much as a sort of discussion point. You know, this hopefully will be our last COVID-focused meeting ever, but there's obviously no guarantee of that. And you know, at some point we may need to bring these meetings back and meet twice monthly again if we do see a big spike in cases. And, you know, I guess we can discuss in future meetings at what point we would do that if needed.
Sure, absolutely.
Difficult to predict, but, you know, just reminding everybody that these may come back.
And it's not to say that COVID-19 won't be a topic at regularly scheduled board meetings as well.
Definitely.
Yep.
Yep, definitely. But, you know, it's great that we're at a point where the staff who've been working so hard do get to take some vacation time in the summer. So well deserved.
I think we're all looking forward to that, definitely. The late Thursday night, I believe the legislature passed, and then I don't know if it's early Friday morning or Friday afternoon, the governor signed a bill that allows certain provisions that were in place during the pandemic to be extended further. You know, there were some related to sort of takeout cocktails, but the one that was of most concern to me was remote meeting participation. I think given sort of the board members' professional commitments, it's often challenging to find meeting times, let alone meeting dates when everyone is physically available. I think there's also real value for two reasons in having the meetings on Zoom recorded. Sorry, I shouldn't say on Zoom, having them recorded. One is certainly if residents aren't able to come to the meeting, they have the ability to not just read the meeting minutes, but to actually watch the recording and hear the discussion. That would be something I'd love to figure out how to continue. It also is valuable to us because sometimes it's very hard to find recording secretaries. And when the meeting is recorded, we can have a recording secretary who can take meeting minutes at his or her leisure. They can, you know, do it from home, and that often leads to higher quality members doing the recording. So I'm hoping to continue that. We have a reprieve given that the governor has extended things for a little while, but it will be up to the board's discretion when it wants to return to full in-person meetings, whether it wants to keep Zoom meetings, which are recorded. I have indicated to the town manager and the assistant town manager, Katie King, that I believe the Board of Health would like, and I think the Public Health Division would like, that if we do return to full in-person meetings, to have the option to have them recorded. Right now, there are only a handful of town boards and committees that are recorded on a regular basis by the Needham Channel. It's the Select Board, the School Committee, the Planning Board, and I think the Zoning Board of Appeals. Finance Committee isn't, Park and Rec Commission isn't, certainly none of the other HHS boards, the Youth Commission or the Council on Aging are recorded. And the Needham Channel doesn't have a ton of staff. So I think the town is looking into what options it would have that it could set up technology in a couple of different conference rooms in town buildings that would allow for you know, camera positions and microphones, and then what sort of training town staff would have to have in place to sort of run those functions. We do have, as I said, a reprieve because the state has allowed for remote meetings to continue for a period of time. But long-term, it's something I think we should talk a little bit more about what the board's preference is and how we can make sure that there are convenient meetings, but also meetings that are available for the public to see and view.
I think that we should move to in-person meetings, and relatively quickly, if only to demonstrate to the town the safety of this. By staying remote, we are sending a message, which I think is not necessarily the public health message that we want to send. And all the data that we have suggests that in-person meetings would be safe at this point in time. I agree that we should have the ability to record, and I think that we should explore hybrids. A couple of television monitors with video cameras in the room where there is an in-person meeting would allow for that process, so that there can be remote participation in a meaningful way. Yes, there'll be some technology, hurdles with that, but I don't think that those should be insurmountable by any means at this point. So that would be my preference.
Yeah,
I'd second that one with a hybrid model. Certainly makes it easier to schedule people if that option exists. But yeah, I agree. We should go back to in person.
Yeah, I agree too. And I know the technology can be a little daunting to make work, but I think probably we'll learn just like we learned how to do this. So.
and every workplace is experiencing this right now. I can tell you, we're all trying to figure out how to do hybrid meetings, and you probably are too, right? So it needs to be solved somehow. But yeah, I think, and having those recorded meetings is very informative for anybody that wants to watch them. I mean, I watched Wellesley's all year and could keep track of what was happening there as well. So it is really informative to have that information out there. So, and I suggested we start meeting in person last fall. I suggested it to Tim, and masked and distanced in a school. Luckily, the school committee did that. So glad somebody did. So.
I think certainly there is a balance, saying that in-person meetings are safe, which they are, especially when you have members who are vaccinated, especially when you have the high-level community vaccination that Needham has. I do think there is real value in having sort of recordings available so that no matter how detailed the minutes are, and minutes really should be just a general summary, having the public have a chance to see its elected officials and its professional staff engage in discussions about important issues, I think is really valuable. So it's my hope that the town can move quickly on that. I don't know. I know that the town's timeframe for being able to outfit multiple rooms for hybrid meetings was months, not a month or 2 months. It was many months. So I don't know what they'll be able to do to sort of accelerate that pace, whether it's something that would be possible in October or earlier, or if it's something that's going to come in 2022.
Possibly we could make a deal with the senior center, because I heard that they have the equipment necessarily to run hybrid meetings, or they're getting it.
We are getting some of them. I don't know if it would do exactly everything that we're hoping for a board meeting, but it would be a step in the right direction, absolutely. And I know some of the people over there, so. Are there, sorry, Rob, yes.
I was just going to say, so our next regular monthly meeting is on July 29th. Are we all agreed we should do that in person?
So it's certainly to the board's discretion. We have a room reserved. We could certainly do an in-person meeting, whatever the board prefers.
Kathleen, Steve, Ed?
Yeah.
Even if it means it can't be recorded or whatever, I think it is hard because it sends a message, but if nobody sees the message, but I still think it's worth meeting in person.
I agree.
Okay. So we will plan for that to be an in-person meeting. I've actually already worked with the Needham Channel to see if they would do us a favor and arrange coverage. And Mark Mandel, the executive director, did say he was willing to do that, although he said he couldn't commit to doing that every month going forward. So if nothing else, we can have that in-person July 29th meeting recorded, which would be great. I do think it doesn't fully answer the long-term question, which we'll work on. Knowing that the board wants to have in-person meetings, but wants to make the recordings available to the public.
What time would that meeting be?
9 to 11, the morning of July 29th.
Okay.
The availability of the board members for August was very challenging to find time when 3 people were available. I proposed some September dates, but as Steve pointed out, I didn't realize I was proposing one on the eve of a Jewish holy day. So I think I have to go back to, between Labor Day and the Jewish holy day, I have to go back to sort of the beginning and find some different September dates that might work. I know, Steve, you had said
I generally can't do Wednesdays because we have lab meeting on Wednesdays.
Okay. Okay, I'll try to stay away from Wednesdays. Steve, you had said the ED hadn't set its schedule yet for September?
Correct. I mean, I'm hoping I'm going to have that by the end of the month.
Okay.
Rob, I don't know if you're participating in the boards in September.
In October.
All right. Yeah, I'm doing September, so we may have a trade-off there.
All right. Well, I guess Tim, send out the poll and we'll see what we can work out.
We got.
Yep. Sounds good.
Okay. Other items for discussion?
Last night at select board, they're talking about alcohol licenses and things like that, and that Board of Health is kind of a-okay with everything being extended, which I am, like outdoor dining and things, but I just don't know, have we been really consulted on some of those things, and have we seen any issues with public drinking?
So we haven't seen many issues with public drinking recently. The Norfolk County District Attorney's Office sends out, I believe it's called Place of Last Drink Report. So all police departments and state police report when they pull over someone who is intoxicated while driving. They ask, where were you drinking? Where were you served? Now, this isn't binding. No one arrests anyone, any bartender or anything based on this, because it is just what the person is reporting. And sometimes people aren't accurate, but in general, people have been accurate. So the town always follows up when it has people on that list, and for either 2 or 3 quarters, we haven't had anyone on that list. Usually we have 1 or 2 community restaurants, but we haven't had anyone for the last 2 or 3 quarters. I'll have to check whether it's 2 or 3, which is a positive. Certainly the total volume of patrons is down, so I draw from that conclusion what you will. I think there is certainly the town's desire to expand economic development and expand sort of restaurants through alcohol licenses, which is often where a restaurant makes its profit margin. From my perspective, we have largely responsible establishments in Needham that follow the rules. I think one of my strong desires, and I think the board should talk more about it, is to have the select board either enforce itself or give the Board of Health and the Public Health Division some power to enforce the in-person training requirement. We know that there's a difference between the quality sort of the, for lack of a better word, education you get from a 4-hour in-person class as opposed to a 30-minute online course where you just click yes, 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 yes. We think there's real value there. A number of our staff members, including Carol Reed, a number of members in the Needham Police Department, a number of members from our SAPSI area are trained in TIPS, which is the training for alcohol beverage service. And there was a training, Tiffany, was it last week, I think, between Needham and Dedham where we trained?
Monday.
It was Monday. Oh, boy, that feels like a long time ago. So I think there, from my perspective, enforcing that and having staff come to an in-person training makes them much better able to understand their roles and responsibilities and sort of how they have to guard against sort of people over consuming, what ways they can cut people off without causing an incident, how they can facilitate someone getting home safely. So we strongly prefer the in-person. The board had, in its wisdom, a few years ago asked me to work with the town manager's office to insert language about in-person training. And I'd like to work with the Board of Health and the Select Board to try to make sure that that is sort of a hard requirement that is adhered to.
I think that's good. I mean, I don't want to interfere with the, some of the license. Well, we don't have any control over the licensing, but more about, abuse and making sure that people are trained and not over serving and underage and all that. Thank you.
We do anticipate that we will resume doing at some point alcohol compliance checks, which we do collaboratively with the Needham Police Department. We do anticipate that tobacco compliance checks will resume at some point soon. So that's always a good way to test whether people are paying attention to the training and whether there is sort of proper management control in place at both Section 12 and Section 15 licensees. So on premises and off premises.
I can give an update, Tim. We do have a tobacco check scheduled for this Friday. Actually, I don't want to advertise it, but yeah, so we are starting those back up again. So we'll keep trying to do those quarterly if you want us to continue those. So
I think quarterly has worked well. I think our goal was to eventually get alcohol compliance checks to be quarterly, just as tobacco compliance checks are. Needham Police and Chief Schlittler and his team are very serious about alcohol compliance, and they are obviously good partners with us in tobacco compliance. So we're looking forward to getting sort of those back on schedule. They were obviously somewhat frailed by the pandemic.
Great. Other items? All right, I guess I will look for a motion to adjourn.
So moved.
Second.
Okay, and roll call vote. Kathleen,
Yes.
Steve,
Yes.
Ed,
Yes.
and Rob is yes. So we are adjourned. Thank you so much, everybody.
Thank you.
See you in July.